Hi, my name is Elizabeth Almanza, and I'm going to talk about botulism. But first, let's start with what botulism really means. According to the CDC webpage, botulism is defined as a rare but potentially deadly illness caused by a poison, most commonly produced by a microorganism called Clostridium botulinum. Clostridium botulinum is found in soil and can survive, grow, and produce a toxin in certain conditions, such as when food isn't properly canned. As little as 1 nanogram per kilogram can be lethal to an individual, and scientists have estimated that about 1 gram could potentially kill 1 million people. Thus, botulism is a public health issue and should be reported immediately to the U.S. government or to the CDC. In the United States, there's an average of 110 cases of botulism reported each year. If left untreated, there is a 50% mortality rate, while treated individuals have a 3 to 5% mortality rate. There's actually 5 types of botulism, which are wound botulism, adult intestinal toxemia, infant botulism, iatrogenic botulism, and foodborne botulism. Foodborne botulism happens by eating or injecting foods that have been contaminated with botulinum toxin. Wound botulism can happen if spores of the bacteria get into an open wound. Infant botulism can happen if the spores of the microorganism get into an infant's intestines, where the spores grow and produce a toxin which causes the illness. Adult intestinal toxemia botulism is a very rare kind of botulism that can happen if the spores of the bacteria get into an adult intestine, grow, and produce a toxin, similar to infant botulism, although we don't know why people get this kind of botulism. People who have serious health conditions that affect the gut are more likely to be prone to this illness. Iatrogenic botulism can happen if too much botulism is injected for cosmetic reasons, such as for wrinkles, or medical reasons, such as migraines. As well, botulism can spread from where it is injected and be considered something serious. Botulism can be seen as a chain of causation where there's an agent, a host, and an environment. The agent could be seen as a bad guy, which is the microorganism referred to itself, Clostridium botulinum. The host is the person or animal that gets infected, such as cattle, sheep, horse, mink, ferrets, and humans. And the environment is where the microorganism is found, which is commonly found in foods associated in an anaerobic environment. But what foods are actually associated with botulism? The commonly associated cause of botulism among infants is honey and corn syrup, while for adults, the commonly associated is canned vegetables, soil, untreated water. But honey does not affect us as bad as how it affects infants. Some of the symptoms associated with botulism are constipation, nausea, vomiting, experiencing dizziness, fatigue, drooling of dryness, blurred vision or double vision, dilated pupil or weak eye muscle, drooping of upper eyelid, or muscle weakness. This is associated with difficulty speaking, difficulty swallowing, paralysis with weak muscles, shortness of breath, slow reflexes, or urinary retention. Some ways to prevent botulism is by taking preventative measures such as primary, secondary, and tertiary prevention. For primary prevention, you can keep food at appropriate temperature, such as keeping the room temperature with the room temperature and the cold ones in the cold environment, such as keeping them in the refrigerator. Discarding of expired foods is another primary prevention, which is a very easy thing to do. Another one is by boiling any canned container for 15 to 20 minutes to destroy the toxin, but unfortunately this is not a commonly practiced. For secondary prevention, early identification of the agent and getting treated ASAP or as soon as possible includes getting treated with an antitoxin which blocks the neurotoxins in the blood. And finally, for tertiary prevention, measures can be taken care of by getting medical help at a hospital or emergency room once the illness is severe, and the doctors will decide what treatment to take or what treatment is more adequate for the patient. Some preventions to be considered when canning at home is by following the instructions recommended by the U.S. Department of Agriculture in the USDA Complete Guide to Home Canning section, or by going to the website actually mentioned in this slide, which is the commonly recent version of how to prepare home canning. Following our instructions for washing, cleaning, or sterilizing container is a way to keep the environment sterile and botulism free. Using pressure canners for low acids foods like potatoes and vegetables it's another preventative measure. Anyways, if someone you know is experiencing any of the symptoms mentioned earlier, you should see a doctor or go to the emergency room immediately, because botulism is a communicable disease that can affect others.